Hello and welcome to week 8. This is the exact middle of our course. And to get a breath of fresh air, okay, sorry, that was a bad pun. This week, we're going to talk about the respiratory system. Are you ready? Okay, so the respiratory system is responsible for expiration, which is breathing out, and inspiration, which is breathing in. And I'm sure you learned in biology class and in high school or junior high or middle school, expiration is where you expel carbon monoxide, and then inspiration is where you bring oxygen into your body, and then it goes through your lungs into the blood system onto the heart. And you learned about that with the circulatory system, right? So the respiratory system has two parts. There's the upper respiratory system and the lower respiratory system. And you may have heard this with, oh, she has an upper respiratory infection, which means the infection is most likely in the sinuses and the nasal cavity, okay, as opposed to something going on in the lungs, okay? All right, so there we go. The upper respiratory system starts with the nose, then the nasal cavity, the nasal conchae, the paranasal sinuses, the internal nares, which is inside your nose, right? And your nasopharynx, which is where your nose kind of hooks up with your throat, right? It's your pharynx. So you have your nasopharynx, your pharynx, your oropharynx, which is the back of your mouth. Okay, and that goes down pharynx into the larynx. Ha la 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 la. It's nice that it rhymes, right? But you can see here all that is complicated that's inside your skull being protected. And if you've ever had, you cannot hear anything. Well, and now you're gone. Okay. Let me check my headset says it's working, but now you're gone, Samantha. So hopefully you'll come back and it'll work. Okay. All right. All right. So next, lower respiratory system, as I said, and this starts at your larynx, which is right about here. And then that goes to your trachea, which leads into your bronchus. You know, it looks like a tree, upside down tree. And then your lungs, which contain your bronchioles and your alveoli. Okay. So it's very complicated. All the little parts that go into bringing oxygen into your body and then eliminating that waste of the carbon dioxide. Okay. All right. So words that you need to going beyond the specific, hello? What?
Hey.
Hey.
Sorry.
Can you hear me now?
I had to log in on my phone because for some reason my computer wouldn't let any sound come through, but I'm here now.
Okay, good. All right, and this is being recorded, and of course I will post it as always. All right. All right, so as I was saying, beyond just understanding the medical terms for the anatomical sites, as we've been discussing, okay, you also need to get used to the medical terms for things that can go wrong. In other words, respiratory diagnoses. Again, this is what you will come into, I don't want to say it's kind of included with understanding the terms that describe the specific anatomical site. And you'll remember that, as you can see in all of these diagnoses end in the same suffix itis, which is an inflammation or infection. Okay, and the first part of these terms is the medical term for the specific anatomical site. So you see how it all fits together. So the epiglottitis is inflammation of the top part of the larynx and the supraglottic area, also referred to as supraglottitis. And again, as you're learning in medical terminology, supra means above, glot is the epiglottis, which is the little flap that covers what? Can anybody tell me? It covers the trachea, so that when you're eating, the food does not go down the trachea into your lungs. The food, it closes off, so the food will go down the esophagus into your stomach. Because remember, the esophagus and the trachea are right next to each other in the throat. And when you inhale oxygen, or when you inhale, depending upon how hungry you are, food, okay, it's all going to join in the pharynx, right? Remember, we talked about this, is the different parts of the pharynx, the nasopharynx, which is behind the nose, naso, nose, pharynx, okay? Then you have your oropharynx, which is the pharynx continues down. Your mouth kind of joins in, going down the chute, okay? But as we're just talking, the trachea and the esophagus are next to each other in this tiny little throat. Okay? So what happens when you eat? How do we make sure that the food does not go into your lungs? Because then that is called aspirating food. That those food particles will then cause an infection in the lungs, and the patient could die. Okay, so instead we have the epiglottis, which is this little flap, okay, which covers the trachea. So the food automatically goes right down the esophagus into the stomach. That's genius. This is genius engineering, okay? And if you have any elderly individuals that you work with or in your family, you will learn that as we get older, and I do mean like into your 80s and 90s, okay, the epiglottis starts to deteriorate a bit, which is why the elderly are at risk for getting food into their lungs and having swallow problems. So this is very important. And you know, our body was brilliantly engineered, but it does have an expiration date. And that could be why they call death expiring, you know. But the fact is that many of our pieces parts just kind of stop functioning as well as we get older. Interesting, isn't it? And then medical science finds a way to fix it or to replace it or to something. It's pretty fascinating. Okay, so we have epiglottitis, which is inflammation of the epiglottis. Laryngitis. Anybody ever had laryngitis? You know, where you kind of lose your voice. It's most often caused by speaking loud too much. So you may have experienced laryngitis. after going to a concert and yelling and singing loud, or going to a game, you know, football, baseball, whoever, where you're cheering loud and loud and loud, and you're yelling and you're yelling and you're yelling and you're yelling, and then you can't yell anymore. Okay. I know this will come as a total shock to you, but I used to get laryngitis all the time when I was a kid. All right. Laryngotracheitis. So now we not only have inflammation of the larynx, we also have inflammation of the trachea. So that means there's a whole lot of bad stuff going on in here. Okay. Nasopharyngitis would be an infection in the back of the nose where, and you know, that's why if have you ever seen or had the experience where you drink milk and then it comes out your nose? That's because of the pharynx that's connecting the back of the nose to the back of the mouth. Okay. And also why, you know, maybe when you have a cold, you have drip, post-nasal drip, post, behind, nasal, drip, that drip of mucus down your throat. Oh, sometimes the body is disgusting. I don't know. All right. Pharyngitis, rhinitis. Okay, rhinitis, that's what you get when you have a cold and your nose is all right. This is your rhino. Remember that, right? Rhino, just like the animal, that's the medical term for your nose. All right. Congenital anomalies. Sadly, babies can be born with problems with their lungs. Now, respiratory distress syndrome is one of the most common afflictions of premature babies. And that is because the lungs actually are one of the last anatomical structures to form in utero. So when a baby is born too early, that is one of the most frequent or most common conditions of that situation. Cyanosis, cyan, the color blue, cyan. Osis is a condition of, remember? Okay, osis, condition of, cyan being blue, the color, and that means that there's not enough oxygen being circulated through the body. And so it's exactly what happens if somebody holds their breath too long, they start to turn blue, and that's because of the lack of oxygen. Okay. The most common congenital respiratory disorder is pulmonary hypoplasia, a situation in which the lungs did not form completely or forms improperly in utero. Okay. Remember, congenital means something went wrong in the oven. Okay. Something went wrong while the baby was cooking. All right. Manifestations of other diseases. And remember, manifestations are a situation where one disease has created another problem in the same body. And the only reason that second problem exists is because the patient has the first problem. Okay. All right. One of the most dangerous things about the measles is that it may cause obliterative bronchiolitis. Okay, so that's blocking off the bronchioles, which we need to breathe. And that is very important. Now, fortunately, since we've had the measles vaccine, which is included in the MMR, measles, mumps, rubella, MMR vaccine, that most kids get when they're about to go to school at the age of 5, if not before. Okay, this is one of the reasons why this disease, measles, is so dangerous. Also, the germs can hang in the air in a room for something like 2 hours after the sick patient has left the room. So patient with measles, active measles, goes out of the room. You come into the room an hour later and you can still catch it unless you've been vaccinated. Okay, so left-sided, remember when we talk about left and right on the patients, we're always talking about the patient's left and right, not the physician or the clinician's left and right. So left-sided heart failure can cause pulmonary edema. Pulmonary is one of the medical terms used to referring to the lungs, okay? Edema is an accumulation of fluid. So if you've ever heard somebody wheeze, or it's kind of like a little garbly sound because they're actually bubbling up with fluid in the lungs. It makes breathing, intaking oxygen very difficult for the individual, as well as efficiently getting rid of the carbon dioxide. So it causes a lot of problems. And whenever there's excess fluid, usually the physician will administer diuretics. Diuretics is to get rid of urine, which of course is fluid. Okay, basically a diuretic makes you pee, but it's expelling that excess fluid in your body. Okay, all right. And pleurisy, I actually had a good friend of mine many years ago who died of pleurisy. It's an inflammation of the pleurae, which is part of the membrane that goes around the lungs. And it's most often a complication, a manifestation of pneumonia or lupus, pulmonary infarction. Remember infarct when we did cardiology? Do you remember that? Infarct is necrosis. It's tissue that has died and now is getting in the way. Okay, trauma to the chest, tuberculosis, and many others. So we want to stay healthy. All right, but you might have a patient that you work with or somebody that you know. Lifestyle behaviors. You know, I put smoking because everybody knows. I mean, I don't think that you can be alive and not know that smoking cigars and cigarettes leads to lung cancer. Okay. I should have included vaping because vaping now actually has its own diagnosis of vaping lung, and it is incredibly damaging to your lungs. And I know because I was a teenager once, a while back. Regardless, you know, you think, well, I'm doing this now and I feel fine. So you all are talking through the top of your head. Okay. The problem is it's kind of like mold in your house is when it, you know, it's just a little bit, no problem, but it accumulates and accumulates and accumulates. And the next thing you know, you can't breathe. And if you've ever known somebody who has asthma, it's very scary to not be able to breathe, to suffocate by your own body. So please, no vaping, no smoking, nothing, don't do it, okay? All right. Also, sedentary lifestyles, and that means sitting around, which is dangerous for people like me. I spend all day in front of a computer. So we have to be very alert to getting up and moving around. And you may have heard this, like if you're going to take a very long airplane ride, okay, that you should not sit in your seat the whole entire time. You need to get up and walk around, because when you're sitting for long periods of time, it encourages the creation of thrombi in the leg vessels, veins, and arteries. Okay. A thrombus, thrombi is plural, right? Thrombus is singular. So a thrombus is a blood clot. And a thrombus it's a blood clot that creates attached to the wall of a vein or an artery. Okay. So as it gets bigger and bigger, you can understand how that could block that artery, block blood flow. Uh-oh. Okay. First sign is severe pain in the lower leg, between the knee and the ankle. Okay. What's even worse is, regardless of the size of the thrombus, it can become dislodged. So it will break away from the wall, being attached to the wall of the vein or the artery, and it will start traveling with the blood flow, like a piece of debris in a river or a stream, right? Okay, but then it could get stuck somewhere else, like in your lungs or your heart, going through one of the valves of your heart. And that, is known to cause a heart attack or death. It's just a fact of, I guess it's a fact of life. I don't know. But so what we know is that you got to get up and move. And even if you're like me, who sits in front of a computer all day, I try to get up frequently and go walk around my house because I work from home. Okay. So I walk around my house. I also work out on a treadmill. Okay. So that keeps me moving, keeps my circulation moving so that no blood clots can form. All right. And this is something that can happen to you no matter what your age. And especially because we have people with jobs that sit in front of computers all day long in their 20s. So that means that you're sedentary for a longer period of time across the length of your life. So make sure you get up, walk around, and then come back. You don't have to do anything tremendous, but keep that blood flowing. All right, trauma, I'm sure you know. Trauma, car accidents, anything that can result in trauma to the chest, the throat, or the nose can interfere with a patient's ability to breathe. Okay, so that becomes problematic. If you've ever had a cold where your nose is all stuffed up, right? You know how hard it is to breathe through your mouth all the time and you can't breathe. Okay. Now that gets even worse if your nose is broken. All right. Certainly if there's any trauma to the throat, that will directly impact your ability to bring in air and expel carbon dioxide. Okay. Traumatic pneumothorax. I heard this on a TV show just the other night. I think I was watching the FBI, and the patient had a pneumothorax. Okay. Pneumo is another version of pulmonary. It has to do with air. Okay. Thorax is in the chest. What this means is that air can get caught between the membrane that covers your lungs and your chest cavity, where your ribs are, right? Your ribs and, of course, skin, all this stuff, right? That's protecting it. All right. When that happens, your lungs, remember, you breathe in, right? You breathe in, your lungs expand. You breathe out, your lungs contract. Okay. But if there's air in this space, you can't breathe in deeply enough to get the oxygen in, because that air is preventing you from doing that. The same thing with a hemothorax. Hemo meaning blood. So during a traumatic event, there may be air escaping, there may be blood filling in the chest cavity, preventing the lungs from expanding fully, and therefore being able to breathe in, intake oxygen, and then get rid of carbon dioxide. Both of those situations are very, very dangerous. Okay. And of course, we have the environment, and this goes beyond climate change. This has to do with things that are actually in the environment. Okay, so volcanic dust from an erupting volcano. Now, you know, I don't know, maybe 10, 20 years ago, this would have been a, you know, this is not early Earth, right? But just in the last year, a volcano erupted in Hawaii. Another one erupted in Italy. This is happening. And what happens is, you know, when that volcanic dust comes up from the volcano, it just doesn't fall right there in the area. Air currents will carry it as far as thousands and thousands of miles. This irritates the lungs. The lungs are not made to inhale dust like that, okay? Of course, there are man-made elements, and I'm sure you've heard of asbestos that it may be in the ceiling, it may be in the walls. I think we pretty much got rid of all the asbestos, but it's still an example of something that can be in your environment that can actually harm your ability to breathe properly. That's not your fault, okay? And this has happened in workplaces that don't use proper ventilation and things like that. Then you may have heard about Legionnaire's disease, and there are other aerobic pathogens that travel through the air. Oh, maybe like COVID that travels through the air and then you breathe it in. Exactly why masks help stop the transmission of COVID, because then the pathogen has to go through a filter and it helps you continue to breathe properly. This is something we want from you. So you can see the respiratory system is very, very busy, has a lot to do. And remember, without oxygen and getting rid of carbon dioxide, your body cannot function. Okay, so remember to keep your foundation strong in your vocabulary. I recommend do not try to memorize. Instead, review it often. Let repetition put this implanted in your brain cells. When you're doing your homework and you're doing, as you continue on in your education, use a medical dictionary, and a medical dictionary, not a regular dictionary, because there are some words that are used in regular language that do not mean the same when it's being used in healthcare. And query when necessary. Whenever you have a question, you really need to email me and ask me so I can answer it. It helps me feel useful, okay? Also, remember, you have a dedicated medical terminology tutor available to you Wednesday evenings. Just email her at this address for an appointment, okay? All right, I hope you have a wonderful day. Do you have any questions?
No, ma'am.
Great, okay. Well, if something occurs to you, email me. And we can email back and forth. We can set up an appointment to talk. We can do Skype or Zoom or FaceTime. I'm very technologically flexible, okay? Have a wonderful, wonderful day. Stay safe and stay healthy, and keep the good air in and the bad air out, okay?
Yes, ma'am.
Great.